So I want to talk about medical ozone used in intraperitoneal gas used for infection and cancer. So I'll give you a little bit of background, but last night I woke up in the middle of the night and I thought, you know what? And I think I want everybody out there to also do the same thing. If you think of a technique that you think is unique, let's coin it with your name on it, because when we get ozone into mainstream medicine, I don't want to forget all of you guys who are pioneers too, that are experimenting with different ways of delivering ozone, and we should get credit for it. You know, this is a modality that is not in its infancy, but is in a place where creativity is appreciated. So if you've thought of a creative way, put your name on it, you know? So I decided last night in the middle of the night, I'm going to do it. So I'll show it to you, the slide. So again, how can this gas injection be so effective? So intraperitoneal ozone injections have been around. Medical ozone typically involves introducing ozone into the body through various routes, insufflation into a body cavity. In case of abdominal application, ozone gas can be administered through rectal insufflation or direct injection into the abdominal cavity under medical supervision. These methods allow ozone gas to be absorbed through the mucous membranes or directly into the mainstream, into the bloodstream, where it can exert its therapeutic effects. And this was from Chat AI, whatever. So this is getting to be something that people are hearing about, right? So the intraperitoneal application of ozone in postoperative sepsis model in the rats, and this was done by Siegfried Schultz with Zule Zamaro, and he was the one who really wrote this in 2002, putting it into mice for intraperitoneal ozone injections, and doing it for septic shock. And so I had read that when I first started doing ozone, but I had never tried to do intraperitoneal ozone. So again, when you read articles from other countries, do you have the same level of it's not in mainstream medicine, but these earlier research articles are so valuable to us. So I went to the Ozone Frontiers meeting in 2016, and Adriano Caquete from Brazil was giving a lecture on giving intraperitoneal ozone injections into a dog. This is a cat that he was doing, but it was a dog that he had masses in both the thoracic and abdominal cavity and was told to be euthanized. He did 20 IP injections. And the first ones that he started to do, he did it through guided ultrasound through the linea alba. So the dog had to be put under general anesthesia, and the injection was done through the linea alba with that anesthesia and ultrasound. And so he kept it up for 2 years. This was an animal that was supposed to be dead 2 years before, and when he was lecturing, the dog was still alive. So I was blown away by that. Like, my goodness, he had a cancer in the abdomen and the thoracic cavity, and the dog was still alive after everyone else said euthanize. And again, all of you out there, that's why you do ozone, is that you want to try to find some other way to give that animal more time and figure out how to take care of them. So I decided I decided to give myself credit for doing the Roman intraperitoneal gas ozone technique. I called it REGOT. So, but I had to figure out a way how to do something on an animal that is so critical that putting them under general anesthesia was a high risk. And also, I don't have ultrasound. I do, but I don't have one I have an old machine and it doesn't work right now. And so I don't have an in-house ultrasound machine. So what can I use that could make this technique easy for anyone to use? And so since I had taught anatomy at Tufts University for almost 20 years, I felt like I could use my anatomical, understanding of where the body was and go through this. And I'm just going to go through it, and then I'm going to show you what it is. So we have the dog standing in the paralumbar area standing. So there's no anesthesia, and you want to have that dog standing up and shave that area when it's standing, because if you don't shave it, if you shave it prior, you think where it is, when they stand up, everything shifts. So you got to shave it when the animal is standing, and use a 2-inch ozone resistant indwelling catheter. And I'll have pictures of that. You load up your volume from between 24 and 41 micrograms per milliliter, depending on what you're treating. So if you're treating peritonitis, you want to go to the 40 side. If you're treating cancer, you want to go to the 24 side. And have the syringes filled, capped off with sterile needles, because this is a sterile procedure. And I always don't set them up straight because they're usually big syringes and you don't want them to fall over. You want to like use them in 10 minutes if you can, but maximum amount of time is about 20 minutes, because then you start having degradation of the ozone. You want to push the catheter through the abdominal wall, and you're prepping the area, and you push that catheter and you can feel it popping through that peritoneal lining, and you want to stabilize it and just let it go a little bit deeper and leaving the indwelling catheter in, and without taping. You're not putting any tape in it, but you're using the stylet to make a hole through it, and then you slide that catheter in just a little bit more. Sometimes it hits something, so you want to be able to keep your catheter, the needle stylet, back into the sleeves, because you may have to use it to thread it again. And these catheters are probably cost like $3-4, so there's not a huge financial expense. You hook it up to this catheter in the syringe, and you slowly start infusing the gas into the abdomen. If the catheter kinks, then either rethread the catheter with the sterile stylet, or slightly shift the catheter, pulling it out a little bit, and move it around. If it starts to really kink, you're probably going to have to use another catheter, because that can happen. You continue to do the additional syringes with the ozone gas, and if the catheter changes its position, you may need to use another stylet to straighten out the catheter. Always remember that you do not want to injure any internal structures. And again, if you have ultrasound, but that means somebody's got to be holding the ultrasound, because you've got to use two hands to do this procedure. And if you put the animal on the side, the belly sort of lays flat, and you have a chance, I think, of possibly injuring something. Pull out the catheter and wipe the surface with alcohol and allow the animal to sit still. So that's just sort of the technique. So if we look at an anatomy drawing here, we're going to be making that shaved area right on the left side of the animal, where this is actually the right side. This is flipped over. So we're going to do it on the right side. So it's going to be on the right side, not the left side, but I didn't have a picture to transpose it. So you can see, if you take an x-ray, there's not a lot of material that's there, in the body. So you can go in, you'll go right above the colon area. So treating ozone for the abdominal area could be done. You can use it for infections, for peritonitis, for cancer of all the other organs. And again, we're using a very small catheter, which is, I'll show you a picture of it. It's a 20 gauge needle. And again, this is on the right side. So this picture is Baxter, and he had a liver cancer and was told to be euthanized at 14. And he couldn't stand, he couldn't walk. And I had gone to that lecture to watch Adriana do the IP ozone, and he came in with liver functions of over 5,000. And I said, well, let's try ozonated gas in the abdomen, because I can't, we did ozone, we did UVBI, we did all the other things, but let's try to see if we can reduce that liver function. So we started out at 24 micrograms. These are the catheters that we use. They were 20 by 20 gauge, weigh 2 inches, and they're called Shervet IVs. And you can see next to this one, there's a 1-inch catheter, which is what we typically use, when we put an indwelling catheter. So they are longer. So he was getting support through his life with Dr. Kitty Ruptured. And then if you know her, she was one of the earlier ozone veterinarians too. She passed away several years ago, but she came in 2016. And the owner had purchased a hummingbird machine and was doing rectal ozone at home too, supporting the dog. So here's the perilumbar area that we're shaving the area. We're putting the catheter in. We're showing how the catheter is in that size plank. And then we're hooking the needle up and making sure that the needle doesn't kink. Because if it kinks, you're fighting, an organ probably has slid against it. And you just keep putting the gas in, starting with a smaller amount of gas initially, and then you can go up higher. So in this case, we actually started at 120, and the dog seemed to be not, and he had ozone before, but I think it was too much. So we cut back and we went to 60 and then moved up to 240 cc's. And then, if the catheter gets kinked, get a new one. So here's the video of this injection that we're doing. So we've got 2 large 160 cc syringes that are pretty much full. And the dog is standing. The owner is helping us hold the dog up, sliding that stylet out. Catheter stays in. I'm putting it back and keeping it sterile so that I can use it again if I need to thread it again. And then I'm hooking up the syringe and putting the gas in. And again, you can go slow in the beginning, and then once you sort of get in there, it's not as it can kink a little bit. I'll try to pull it out a little bit because sometimes I'm pushing on it and it's kinking the syringe. So I'm pulling it in and out a little bit. So again, he had multiple IP injections. He also had hyperbaric. He also had, and his liver
having to
function
push a little bit to get it going. It seems to be
it's
grabbing onto something.
Yeah. So you might have to you can feel it, the body sort of pushing back on it. So he had multiple, and you want to use this up again. You want to get it drawn up
straight
and
up
put
so
it
it
in.
doesn't tip until you're ready to go into it.
Right. So you want to keep it so you're not dropping any of that ozone out. So he again has
that's going easier.
Ended up living 2.5 years. But see how I kinked it when he moved? So you want to try to keep that straight so it goes all the way in.
Margo, too, if you want to narrate, you can just hover over the video and then turn the audio off.
So turn the audio
off. For the video off. There's a little audio button down there. You were just over it.
Okay. Is that okay? Wait,
yeah.
I guess it's not right. Anyway, I think I screwed up something. Okay, 1 second. Anyway, but that's basically okay. So we'll go to the next slide. So after his injection, I mean, you can see his color was really pink. He was very pale, and now his color it got picked up right away. And then afterwards, he was very jittery.
So you said he's twitching. Where is he
twitching?
Right here, behind his right shoulder.
Okay. His tongue is real pink. Baxter, what did you think about this procedure?
He has laryngeal paralysis, so that you'll hear a lot of panting from him.
So you said
so this is 8 months after the first ozone IP injection with liver cancer, and he ended up living 2 more years, up to 16 and a half.
Awesome.
So the next case is a 8-year-old chocolate lab. It was unable to stand and almost morbid. He just she couldn't stand up, and the owner was going to euthanize it at another vet because she didn't have any funds to take care of it. And I thought maybe it was a possible Pyometra. So I opened up the abdomen. I took it immediately into surgery and said, if it's cancer, I'll put it to sleep on the table. If it's a pyo, I'll try to fix it. Well, I have never in my career had a ruptured pyo that had been ruptured. It probably had been ruptured 72 hours prior. So all these videos are up there, and you guys can watch them in full if you want to. And they're also on my website, but I left them in here because it was such a serious peritonitis that there was pus pouring out of the abdomen. So a client of mine who was a forensic pathologist said that adhesions that the dog had on it were at least 72 hours after rupture, because there was all these adhesions where when I pulled it away, there was pus pouring all over the abdomen.
I opened up the uterus.
Pus came out. Just pus is pouring out of it.
So my assumption is that the uterus has ruptured, and we're just making the incision bigger. We're going to still try to do something by lavaging the whole abdomen after we get the uterus out of here. But you can see this peritonitis that's there on this. So we needed to rush in and do her like ASAP. This is all peritonitis, okay? Inflamed everywhere. And her uterus is right here. So
I'm not going to play the whole thing. Here are some of the pictures of the uterus, and you can see it was pretty bad. But there was just pus in like 3 places where it had ruptured, and it was pus coming out. And we did a complete ovarian hysterectomy and did that. And then what all of you probably are doing now is lavaging the abdomen with ozonated saline. Here's just another, quick video of lavaging all the organ systems in there, whether it's the intestines or whatever we're doing, cleaning and flushing, cleaning and flushing, cleaning and flushing, trying to reduce the amount of bacterial load that's in the abdomen. So we have the ozone saline in the room, and we're just using that directly as it's bubbled right out into the abdomen. And again, cleaning up everything, trying to get rid of any pus anywhere, and we did homeopathics as well. And then the repeatedly, wiping everything. I mean, just trying to clean it up and just throwing it right into the abdomen and soaking up our gauze just to make sure there's no problem. Okay, so after surgery, we did acupuncture for pain, and we did major autohemotherapy with 4.5 cc's of blood, 45 cc's of ozonated saline, 1 cc of Biotin, using the Geneva method, which is the one that I developed from my dog who was thrombocytopenic, so I never used any anticoagulants, and we ran it through the UVBI done with the chimp. And we did vaginal flushes, 30 cc's of ozonated saline up the vaginal area to clean out the vulval lips and all the scabs from all the stuff that was going on down there. And she's getting acupuncture, circle of the dragon, as well as those points. So she had, I figured when to use antibiotics, okay? The owners didn't have any money. Actually, they still have not paid me the bills. So anyway, they paid like a third of it, and it has not been paid. And this was like 6 years ago now, 5 years ago. And so I gave it, I had 500 milligrams of amoxicillin injectable, and I had Clavamox in the building. So I sent it home with Clavamox and, took care of her. But so interesting, she came in moribund. She was unconscious, had no reflect. She just looked like she was dead. And we finished the treatment took about 2 hours. And by the time when we finished the treatment of doing the hysterectomy and everything else, she was starting to sit up, and we gave her ozonated water to start drinking. And she drank about a cup of water. And we used high arnica 10M and Bellus Perennis 10M for pain management. I did send her home with the Clavamox and pain medication. He never used the pain medication. She wasn't in any pain. So, 2.5 hours after surgery, this dog was up, not walking. And he never used the Rimadyl. And we did 3 days of Clavamox, and then we stopped that because the incision was fine. So here she's getting her UVB treatment here. And this is another way. This is 24 hours after surgery. She's getting an ozone injection, not a real high level because she's not used to ozone, but we've already prepped her, and she's standing. She couldn't stand at all the day before until she, this was her first day at the clinic where she could actually stand. And then we are giving her ozone, but she also had the UVBI that day, and she had sub-Q ozone saline that day. So we're just trying to use the ozone to prevent infection. So we did 24 micrograms. I would have done higher if this dog had ozone prior and gone with a higher amount. But I was nervous because she had not done it.
Don't sit. Stay still. Okay, that was hard to push because it's probably. Okay, it's doing something. Okay.
So with her incision, we used ozone saline to flush that incision to keep it clean, and used ozone to flush her vulva. Use ozone. I mean, everywhere that I can use ozone, and I don't need to do anything else with any other kind of disinfectant. They talked about using all these other, chlorhexidine and betadine. You're disrupting the microbiome. If we can disrupt the microbiome with ozone and not have to use other disinfectants, it's always, I think, a great way to try to navigate it. Here we're doing ozone in the incision because it was an infected incision, and just using that. And this is her 72 hours later.
Here, this way.
She's a dysplastic dog. So this is
dog. 3 days after a Pyometra that ruptured with peritonitis. The dog does have hip issues, but this is a dog that had a complete ruptured uterus with acute chronic. Peritonitis. Here, this way.
So I was looking online about intraperitoneal ozone injections in humans, and there was this physician who lectured at Ozone Without Borders conference and did a whole lecture on putting, if you have an indwelling abdominal drain or whatever in the abdomen, that's not a rubber drain, you can inject ozone gas for pancreatitis and for abdominal cancer. And this video that was on the power of ozone showed how they were putting indwelling catheter into a person. So they looked like the person was under general anesthesia, or at least it looked like it from the picture. And they basically made a midline incision and then put didn't fix it in the midline, but put it to one side. And then it was injecting ozone into this person's abdomen. And so that's pretty invasive. Using that little catheter that costs $2 or $3 and just tossing it at the end seems like a much less expensive and easier way to give it to our dogs and cats. I have not done it that way in cats. I've done a little bit of that, but mostly it's saline that I use in cats. And so thinking about ozonated saline for your abdominal pain, infection, and cancer, because that dog never had any pain at all from the surgery, from the space surgery. And you would think that the dog would have pain, but I always wondered if the dog was in such pain from its dysplasia that abdominal pain seemed like nothing compared to the way this dog's, watching her walk. We got her to a chiropractor and did more ozone and had that clear up too as well. So just want to have everybody think about all the different ways that we have been able to utilize ozone. And there's so many more ways that we can do that. And again, if anyone has any questions about it, I wanted to cover more of each case, but Jonathan said, just do technique. So I'm just doing technique for Jonathan. So we're just trying to get different ways of doing things.
Awesome. Excellent.
Okay, did I time?
Yeah, and if you want to stop sharing your screen, okay, if there are questions, go ahead and put those in right now, and we'll try to cover some of those. Thank you. That was excellent. It was super clear and concise,
good.
and I think that's just very helpful to be able to consider how to do that, on Monday for some of these people. Like, just go start doing it. I'm gonna actually, you guys go ahead and ask questions, but I'm going to start a poll right now. Okay, I want to see how many of you are actually doing IP ozone in your practice. So if you can go ahead and click yes or no, you should see that poll on your screen right now, and let us know. I think you should see it. I'm seeing it showing up. I'm not seeing anybody yet submit anything though. So maybe
they're all doing it, which is great.
maybe it's not showing up for everyone.
Poll. Where's the poll? Handouts, questions. Oh, here's poll.
Yes, no. Okay. Okay, so here I'll start asking a few questions. I'll leave that up. What do you use to generate O3 and have control over concentration? That's a pretty easy one.
Yeah, so I really love the longevity machine. Now, those of you that have longevity machines know that longevity had to relocate to the United States. They changed their name to Southern, was it Southern? If you type in ozone generators longevity, you'll get it. It's Southern Star, I think is the name. So they had an issue with the Canadian government, and the government was harassing them about the ozone generators. So they moved their company over the border. And since they have moved and they're over, I've tried to contact them for 5 months and I have not had a connection. So they're there, and I really like that machine. There are other, the Cetical machine also can calibrate to that amount to know what you're doing. I think you really want to use a higher quality machine if you're doing intravenous work or you're doing intraperitoneal work, so you know where you are. It's not sort of a vague spot. I think the smaller little machines are are fine for rectal ozone and for ozonated water and things like that. But I think getting specific amounts needs to be a closely, able to determine that.
Yeah. Okay. So here's the results on that poll. So actually, 42% are saying they do it. That's
Good.
actually higher than I thought it would be. 58% saying no. I see somebody saying you convinced them though, so they're going to start.
So, the scary part of doing anything when you put a needle in is if you have ultrasound, that's the best way. But often it's going to be hard to do it with one hand and try to do it very quickly. And of course, in talking to, and I'm hoping he's on because I talked to Trupanion yesterday, the guy, Peter Beaumont from Trupanion, and they used to cover ozone and then they stopped covering ozone like 6 years ago. And I'm very, very upset about it because it saves so much cost and for the owner, and the results are so wonderful. And I was hoping he would watch this to see all the wonderful research that's going on and the reasons that we need to control infection without antibiotics, because antibiotics don't work anymore. And they're from the 1900s, and they just have not been able to keep up with the changing of resistance and stuff. So, and hopefully that, if you don't have to use ultrasound and you don't have to put them under general anesthesia, the cost of doing that is reduced tremendously so that people can do these therapies and not have to, people say, I can't afford to do it, so we have to be able to keep our clients' costs in a way that they'll go for all the things that we're able to do.
Yeah. Okay. So next question, how many treatments and how far apart are IP treatments for cancer?
So with Baxter, we were doing other forms of ozone too. So we were doing UVBI and we were doing hyperbaric and we were doing sub-Q. So can I get a higher amount of ozone directly around that cancer? And I have not done that many. I'd love everybody to start putting that into their mix with their liver cancers or their abdominal cancers, where they're getting it right there, surrounding it. Seems like a logical thing to try to do. Obviously, rectal ozone will get absorbed by the colorectal vein and go into the liver and go into the body. So it's a much more something that people can do at home and do it themselves. So I think the IP part, because this dog had peritonitis and because this dog's liver functions were 5,000, I felt like I needed to get it to another level.
Good. So Dr. Caputo says that she's used O3 saline IP, but what's the advantage of doing gas versus saline in your opinion?
Well, I think I've used IP, obviously when I'm doing lavaging the abdomen and injecting, putting lavaging, that's intraperitoneal ozone saline is doing it that way. Doing the gas, if you have, a lot of extra fluid in the abdomen, it's not getting absorbed, you can get more ascites if it's something from the liver, whereas the gas is not that issue. In the case of Baxter, he bled out, so he had a lot of blood in his belly. And so that was another thing that, I wanted to get the ozone in there and not add any more fluid into the abdomen. But I think you can, definitely there was ozonated saline in that chocolate lab, because I had lavaged that abdomen like 3 times with ozonated saline. So that's where, that dog got a lot of ozone, had never had ozone. That's why I was trying to overdose the dog. And I gave her maple syrup when she woke up, because it does take down the blood sugar. And you want to just make sure you're making them hypoglycemic, and then you don't know whether they are having a problem or they actually are just low blood sugar.
Yeah. Okay. Have you used this for FIP in cats?
I tried. I had a client, the cat was doing really well, and I was very excited about it. And the owner was a younger, young, like late teens, early 20s. And her mother said, I don't want to do this anymore. I want you to put the cat down. But the cat was actually doing well. It was a wet form of FIP. And so but I would love somebody else to try it on a cat and just see if they can control the viral load and bring down the inflammation.
So somebody would like you to be real specific on the location of the catheter.
Okay, so if we go back, it's, if I share the screen again, 1 second. Let me go back. This slide here.
It was up there for a second, but we don't see it.
I don't see it now? Oh,
No.
sorry. Okay, 1 second. Sorry, go back. Share screen. New window. This one. Okay, see it now?
Yes.
Okay, so basically we shaved this area so it's in front of the foreleg in the part of the femur, but high, like it's this one looks a little bit on the low. It probably could be just a teeny bit higher, like right in here. Okay, so if you look at this and that I tried to take a picture, just show that it's below the lumbar area, probably like where L6 is right here, L5, 6 around in here. And then you want to inject it in there. Again, I do it on the right side. This was only a left side pictures. So it's just trying to stay right in front of the leg, right. You don't want to go as far back as where your kidney would be. You're just going to be right in that middle section.
Yeah. Okay. Okay. We only have time for maybe one more question here. Have you came across patients who cannot tolerate IP ozone?
I did with Baxter right here. The first time I figured he'd had ozone before, so I'll start with 120 cc's, and that was too much for him. And I actually talked to an animal communicator, and I said, what dosage should I use? Because I wasn't sure, but because she had been talking to him anyway, and he said, no, cut it back halfway and then work your way up. So that was what he told her. So, we have to thank Baxter or the communicator. But I should have started low, but it was my first time doing it. And I figured he's so used to ozone, I should be able to go high or volume, not a high amount. High micrograms, but he didn't do badly. He just was vibrating like that.
Okay.
And so whether there was some pain associated with it, this dog was extremely tolerant. Both of these dogs were both very tolerable about pain threshold, because I think they had been in such pain all the time from this abdominal bleed and stuff that probably didn't have any change in it. But afterwards, they seemed like they were not in pain at all. So the ozone, I think, relieved the pain.
I said one more, but I'm going to squeeze one more in here. Does IP ozone work with kidney damage or tubular damage?
I think to do it for a dog, you could do IP ozone. Yeah, absolutely. For that, I think that would be helpful. Obviously, I do ozonated saline over the kidneys. That's how I've managed the kidney inflammation. Plus, now I do UVBI and I do acupuncture and I do herbs and I do homeopathics, for kidney failure. Yeah. But the ozone is wonderful. And the other part is the fecal transplant. Both of these dogs got fecal transplants afterwards. And I think that the neurotransmitters and the body coming into balance from being so toxic happens so much more rapid when they have a good microbiome restorative therapy done. And both of these dogs, like with Baxter, he, was 14 and a half. And after this bleed, he was sort of exhausted. He was tired because he had bled out and he was just weak, but he was coming back and he was doing better. And we gave him a fecal transplant from one of my dogs when they were in heat. And 2 days later, he was humping his bed. And they said he hadn't humped his bed since he was 5. And he was now like 14 and a half, almost 15. So they were thrilled. And, he just got his mojo back, getting them in heat.